Hi, I'm Gichi, Chief Wellness Officer of SingHealth and Deputy CEO of Singapore General Hospital. I'm very pleased to be with you today, and I have two very special guests. Could you introduce yourselves as well as talk more about SingHealth Patient Advocacy Network?
My name is Josie. I'm a caregiver to my daughter with a heart condition. And throughout this whole journey, the whole family was immensely grateful to the fantastic and wonderful care that was given by her medical team. When we were approached to be a patient advocate, I said, sure, I can give back to the community to help a bigger pool of patients and partner with the healthcare. Why not?
My name is Kim Soon. I was a caregiver to my late mother, and we spent a lot of time in the hospital. And during that time, we saw a lot of the good work and dedication by the doctors and the nurses. I'm thankful for the opportunity from SingHealth management to open the doors for people like Josie and myself to work together with the healthcare team to enhance patient safety and experience.
For the benefit of some who are new to patient advocacy, what types of projects does SPAN and its advocates work on?
Since inception in 2017, SPAN has completed more than 200 projects, and these projects range from wayfinding to focus group discussions to review of medical leaflets to make them more readable and user-friendly. One of our proudest achievements is actually this plain English glossary, a compilation of 150 commonly used words and terms, and SPAN provided the layman version to make it more accessible and improve the communication between patients and the healthcare professionals.
Having the patient perspective has been great. It allows us to gain a richer perspective as we can see things from different angles, and allows us to reimagine new possibilities, which is better for the users of our services and systems. Can you describe some of the projects that have been particularly meaningful to you?
Remember COVID-19, which stretched the resources of the hospitals around the world to the limit? Back in 2021, we saw a spike in the abuse of healthcare workers. We found that is unacceptable. Abusing healthcare workers doesn't help anyone.
As SPAN group, we came together to form the kindness movement. So the very first thing that we did was to actually write to the forum page of our local newspaper, Straits Times, say no to abuse. We're so grateful we have 8 patient organizations that endorse that with us.
When we saw the letter, it really made us feel very supported and gratified that our patients are speaking up for us.
Back then, I remembered SingHealth management coming to SPAN to ask us to participate in a project to create a set of common values to address the abuse of healthcare workers.
The idea is to bring them together to share what matters to them, to each one of us.
I remember being in one of those early sessions. It was really something special. Right from the start, everyone came in with this positive attitude. There's this real sense of teamwork and all of us being on the same side.
You know what's most interesting about the process? It was the realization that what mattered to the patients also mattered to the healthcare folks. Eventually, the care pledge evolved into 6 elements, which is script, safeguard, communicate, respect, inform, partner, and trust.
We're so happy to see that this care pledge launched at the national level in 2023 by a Minister of State. To help everyone to understand what this pledge is, we actually co-created a video. In that video, we have healthcare staff, patients, or caregiver to act out on what it entails.
It's really interesting to know that even though we play different roles, we have very similar aspirations when it comes to mutual safety and respect. Let's recap some highlights from the video. We can make healthcare better and safer.
We think that partnership is the way forward and the future. While this project started because of the rise in abuse, there are many opportunities for us to work together.
So we created the Care Partnership in Singapore survey to find out what are some of the gaps and opportunity on both sides, from the patients and family and from the healthcare worker, so that we can work out solutions together as partners.
That's fantastic. It really shows how powerful patients as partners can be. And this isn't just a nice idea, it's the future of healthcare. By working together, we're not just transforming and improving care, we're transforming the entire healthcare experience. And I can see this approach being adopted by other institutions and in other countries too. Let's work together to transform healthcare experience, and you know what? It all starts today.
Yeah, let's start today.
Okay.